Carole and Lynda Heather are twins who both retired in March after nearly 42 years working as nurses, neither of them ever having had a day off sick. But their retirement didn't last long. The sisters are both back on the front line in Sussex as part of the NHS temporary workforce. John Hunt reports.
Carole and Lynda Heather could have walked away from their nursing jobs at the Eastbourne District General Hospital last week. After 40 years of service each, with not even a day off sick between them, some might say they deserved a break. With what they've been up against, some might call them heroes.
I don't see myself as a hero. I'm just doing my job. There's lots of other people, key workers out there who are doing their bit, who are putting themselves probably more at risk than I am.
The twins, who lived together, started nursing together, retired together, and then agreed together to stay on and help defeat Covid-19. Both have treated patients with the disease.
There is obviously a risk, but as long as we stick to protecting ourselves and abide by the rules and regulations that are laid out, then hopefully we should all be all right.
Thousands of former NHS staff like Carole and Lynda have answered the call for help. In Eastbourne, because they've separated patients with Covid-19 from those without, they need more nurses.
With Covid, we're having to have more staff on the wards than we normally would have, so they're supplementing our existing staff. And we also have the challenge of staff who are having to self-isolate because of their own vulnerabilities, and the staff who've come back as retire and return have come in to take their place.
Lynda and Carole say they're not yet ready to completely leave the NHS, and the extraordinary situation they find themselves in means that they can continue doing the job they love.